Our next guest is health agent and public health director Paul Mazzuchelli, who's here today to talk about two things. One is, Paul, the board Board of Health just put in some new regulations that are, I think, trend-setting for gyms and health clubs. Mm-hmm. And then also we want to talk about the fact that you're looking at hiring your own public health nurse. So let's talk about the regulations for gyms and health clubs. Sure. Why did you come up with those?
Well, you know, today, especially with the healthcare that's today, you got to be your advocate for your own health. Gyms are being frequented quite often more than they were a few years ago. People are going there to get healthy, to get strong, to more or less avert the disease. But while they are there, let's think of a public health agent. You know, what he has to think about, or she has to think about, and that's, you have a crowd. You're in an enclosed area. You're close proximity to each other. People are coming in, coughing and sneezing and sweating. So more or less that gym that should be making you healthy could be a breeding ground for pathogens. You know, and that's one aspect of it, you know, so that's something that we looked at and says, you know, I wonder if there are regulations somewhere in the state of Massachusetts or in the United States. So I did a due diligence search and I tried to find some regulations that would more or less address hygiene and sanitation in health clubs or gyms or spas, and I didn't find any. Come to find out, what I found mostly was that trade association that they have out there for various gyms or health clubs would more or less give guidelines on this is what you should do to improve your outlook or your facility, you know, to increase customers. And not only it would keep diseases down, or even the skin rashes like MRSA or something. You get one outbreak of that and it's traced to a gym. That gym, you know, should more or less go out of business the next day because that's like the plague.
Okay. Now, you weren't having any problems with Milford?
No, we weren't having them at all. But I felt as though that as a public health official, we should more or less consider it that, Kevin, because there's no continuity amongst the gyms anywhere, not only in Milford, but you may have the cleanest gym in town, and the gym next to you may not have the equipment or the time or to even think that there should be, that they should clean the gym. So
the rules are kind of common sense about cleanliness and things like that.
Well,
some more important ones like having a defibrillator and someone trained in using it. But do you think they put an undue burden on the owners? There's
no.
What, 4 or 5 clubs?
Well, you see, what I did is I took apart a lot of the regulations that the Board of Health should be enforcing, such as camps, swimming pools, housing, food service, body art, and I put them all together. For instance, the first aid, what I did is I wanted any individual who would work at a gym, at least one per shift, to be CPR certified and first aid certified, because if you are going to get hurt, you know, you can get hurt anywhere, but you have a better chance of getting hurt at a gym. You have a better chance of increasing your heart rate, and all of a sudden it becomes a dysfunctional heartbeat and you going down, you know, in a heart attack. And the AED equipment is there to help save you. You know, so it was more or less common sense thinking of that and saying, you know, I think a gym should be a place where they have more continuity, they have some sort of oversight. You know, have a regulation out there that would more or less put everybody on the same page. This is what we have to strive for, you know, to be a better gym. This is what we have to strive for to meet the regulations.
Well, I know I know I took that certification, and I think it was 2 hours to become first aid AED certified. So I don't think that's, you know, a huge task to do that.
You take like the equipment that could be like frayed cables or something like that that's going to snap and you know and hit you. Someone should be on there. I mean, usually time is of the essence, you know, for first aid. You know, someone should be trained to do that. Not only that, but, you know, I got that Al, who's also chairman of the Milford Board of the Upton Board of Health, and you know, with camps, they more or less have to make sure that the people who are watching the children have no criminal record or on predators or anything like that. So let's more or less stratify that and go to a gym. Those who have these nursery areas or these child care areas to watch these children, we want to make sure that they don't have any background.
Well,
like
it goes
that.
to the basic. It really goes to the basic oath that you took as a Board of Health member to protect the health and safety of the community.
Right.
So, your authorization, your authority comes from the state of Massachusetts.
Exactly.
So you have regulations that you have to follow that are state regulations, not just local regulations.
Exactly.
And to fulfill that requirement, it's almost a moral imperative to protect the community. And so I think going forward with the health club thing is a fantastic step.
Right.
I mean, you guys have always been kind of 2 steps ahead of everybody else around taking care of that.
Well, we always try to think outside the box.
Outside the box,
like
yep.
Al was saying, we have those mandated responsibilities that are given to us by the
Right.
state, and most boards of health only have the time to fulfill those.
I know you were also one of the first boards to come up with rules for the medical marijuana treatment facilities,
Exactly.
local rules, things like that. But getting back to this for a minute, any feedback, positive or negative, from the
Well-
gym and health club owners?
Well, what I did is I sent out the draft regulations to all the health club owners, with a certain date to respond if they have any questions or concerns, or they'd like to open up conversation with them, and I didn't hear one. And they someone to the office, the corporate offices of like Planet Fitness and
Right.
Gold's Gym and World's Gym, and they seem to be okay with them.
Are you going to have a public hearing, or are you just going to go ahead and pass a regulation?
I thought that more or less getting that information, getting that letter out for comment, and if we got enough, we would have had one. But seeing we didn't have any interest in it, and it was like you guys both said, it's just
So
straightforward.
they were adopted, and when do they take effect?
They're going to take effect on August 1st.
Okay.
Give us a chance to come up with an application as well as an inspection form, so we could.
Yeah, most people don't realize that the Board of Health can make regulations without having a hearing.
Exactly.
You can establish directives in a hearing without having a hearing. Just establish a rule and regulations.
Exactly. And advertise it once in the paper, or with your
Bingo.
article that you had. That was
Yeah.
enough.
Bingo, it's done.
So I think Al's more qualified to talk about the next subject, but you guys are talking between the Upton Board of Health that Al sits on and your board about hiring a public health nurse,
Right.
sharing in the Upton public health
Sharing the
nurse.
services. I think that's the way it is today. We're in the second decade of the 21st century, and I
Right.
think that we should more or less start doing that. I mean, you got these, you got Milford, you got the surrounding towns, and I think from what we can gather, Upton has a fantastic public health nurse as well as a good board of health as well.
wait.
But you also have a very good public health nurse who's not only geared. Public health is a specialty. When you're a public health nurse, I mean, you just can't. To me, to be an effective public health nurse, you just can't graduate from nursing school, work a little time in the hospital, and become a public health
Well,
nurse.
she's also involved in a lot of other regional issues, the regional, emergency management system.
Right.
She's in tune with a lot of different things. She's really
She not only knows public health, but she knows the basics of a board of health, a local board of
For
health.
the audience, what does a public health nurse
wow.
do?
Community service. I mean, community
Inoculations,
medical health clinics.
Tracking tuberculosis cases,
Disease
flu
investigations.
mitigation, you name it. And then
Home health visits, those who can't afford a pediatrician and they just had babies.
blood pressure tests.
Blood pressure tests, going out to make sure that the baby's eating right, it's healthy enough.
So it's not just the annual
Oh, no.
flu clinics
No.
that you have at the senior center.
There's so much that goes to that.
For example, the H1N1, when that came out about 2 or 3 years ago,
Yeah, 2009.
2009, we had to set up a shot clinic for both Mendon and Upton. Trish has like 40 or 50 volunteer nurses that volunteer to help give inoculation. So it was just a piece of cake to do. So
You see, by being on the Emergency Preparedness Commission like Trish is, she also has access to the Medical Reserve Corps, which I was talking about. They have like these 40, 50 nurses that just are waiting there to volunteer their services to help in clinics and whatnot. So it's going to be a really big help. The visit that we've been using the visiting nurses for over 40 years, and they've always done a very good job, but I think Milford right now needs that individual care, that personal care.
The
that we
VNA
can
is
get.
doing what, 9 towns?
They're doing 9 towns plus Milford, I mean, including Milford.
So now you
And
want to go to just somebody dedicated
we want to
for
go
Milford.
something that's dedicated to Milford, and we feel as though the time that she could allow to us would be probably more time that she could do that she could dedicate to us in a week or two than most likely the visiting nurses had the time to give us all probably the whole year.
So what's the progress between
Oh,
the two towns?
at this point in time, the progress is we have an agreement, tentative agreement that we put together. We have to have the town managers kind of look over, Rick and Blythe Robinson, and the Board of Selectmen, because the agreement has to be signed by the Board of Selectmen in both towns. And then we have to come up with a cost.
It'd be like an administration fee.
Yeah. Which is, you know, it's going to be less than they're paying now.
We're looking at a very substantial savings. We're looking at, you know, even with, you know, taking care of Trish's hourly wage, plus also the administration fee and any equipment or additional supplies we may need to hold our own clinics.
Right, but cost saving is not the only reason for doing this. You wanted more of a
The
personal
service.
touch for the
Well,
town.
the service will be significant, because right now Trish works for the town of Upton for 20 hours a week, and what this would do, the service we get is fantastic, and for you guys it'd be just.
So you'd get the other 20.
The other 20.
And there'd also be what I would like too is where she is knowledgeable. She's not only a nurse, but she's knowledgeable in public health activities. For instance, like on housing, you may go into a house that has a hoarding case, or a child that you may feel as though that's in danger because of the substandard conditions in that property. Trish could assess it on a medical basis, much more better than anybody else.
We've gone through that a couple times in Upton, whether somebody who hoards cats or a hoarder. So what happens is she'll go in as a public health nurse and determine whether or not there's a risk of public health there.
Exactly.
Personal to the person that lives there or whatever. And with that determination, then the Board of Health can move forward on whatever action it has to take. But you need somebody with that experience,
Absolutely.
and Trish brings it to the table. So it'll be a fantastic agreement.
It'll be a big
with it.
plus
Yeah.
to the Board of Health.
Yeah.
And what's the status of this now? Is it close to?
Well, we're down to a tentative agreement that both sides have to look at and cross the T's and dot the I's and make their words are right. And the price, we're trying to figure out exactly what the costs are. And once we get that done, then it's just a case of sitting down and doing it.
You think by the end of June?
I would hope so.
Gosh, I hope so.
That's our target.
So
Our
for the
target
July
is,
1st start of the fiscal year?
Yeah, our target is within the next week or two.
Yeah, we should be very close to that. I mean, there's one piece of information that we're waiting to get back right now, and then once we get that, then we'll have a flavor for it.
So this is a great idea. Well, Paul, thanks for your time today.
Well, thank you for having me. It was very nice. Thanks.
Appreciate it.
Thank you.
Thank you.
Thanks a lot.
Good to
Kevin,
see you
thank
again.
you.
Bye-bye. Our guest for this segment is Jen Ward, the Assistant Director of the Milford Youth Center. My co-host Al Holman can't be here today, but that's okay, Jen. You usually have your director, Sydney DeJesus, glued to your hip, so it's just one-on-one today.
Yep,
So later this year, we'll have on members of the Youth Commission to talk about the exciting news you have about the renovation that town meeting approved. But can you tell me what's going on at the Youth Center now? School's out, you're in your summer programs. What are the kids doing?
Well, today was actually our last day of the after-school program. We follow right with the same academic year, so the kids are just leaving now, I would say. So now we're just in the planning process of getting the summer camp up and running. We are starting right after July 4th week, July 7th, and we'll just open the doors for the summer camp program, and we're still accepting applications actually as well. So
I know the kids tend to go on a lot of trips. Where are you going this year?
yep, we try to change the trips a little bit every year. So Mondays are always our big field trips where we leave town. So we're going to Sky Zone for the first trip. We're going on a Boston trip where we're actually going to get a tour of the Senate House, and that's a new trip that Senator Moore has set up for us. We'll get a pizza party right at the Senate House, and then we're going to go and have a Boston trip for the rest of the day. We go to Canopy Lake Park, Water Whiz, Pins Entertainment. I think that's mostly the Monday trips. I might be missing one or two, but then Tuesday, Wednesday, Thursday are in-town days. We have activities at the center, and then we go to Pheno Pool, and we have movie days at our little cinema that we created inside the center. And then Friday, we always go to Hopkinton State Park.
Okay. And is that the only thing going on in the summer, is the summer camp program?
Pretty much for program-wise for the kids. I mean, we still have rentals. Monday nights, Wednesday nights, and Thursday nights, we actually have the center open. A woman rents it out and does Zumba classes. So those are 8 to 9 Mondays and Wednesdays, and 7 to 8 on Thursdays, where she charges $5 to come in, and there's about 30 30, 40 women that actually come every night
Wow.
to participate in Zumba. So we still are open for rentals, and then we still are obviously in our operations. We have to still run and do our planning for the renovations and for the next upcoming after-school program about where we're going. So.
I don't think unless the average person probably doesn't realize, unless they've gone in the center, as I have, to see you guys in action, how many different groups, programs, people use that thing every day. Let's assume we're still in the school year. What happens in a typical day?
A lot. I mean, Sydney and I are the only full-time staff, so we're there in the morning, and then we have rentals even in the morning. We have a respite group from Hopkinton that has used it year-round. They actually had their last day on Tuesday where they were able to use our Jumpy. It's a group of adults that come in that have special needs, and they come in and use the center, and they play kickball, they walk around the gym, they play basketball. So we have it open in the mornings for things like that, but that's the main time frame where we get to do our our administrative work, because at 2 o'clock the doors open and we have
Yeah, I
kids
usually
come in.
make a point if I want to catch you
In the morning.
in the late morning, so
Exactly.
so you have time to talk.
Exactly, because then we open up for the after-school program, and we have a lot of kids show up from September to April. Those are big numbers coming,
Right.
because we had over 500 registered after-school kids for the entire school year, but it's an average. We see anywhere from 80 to 120 during those months, and then
Right.
it dies down when it gets nice out, which is why we perfectly kind of end that program and then open up for the summer camp program.
But then there's evening programs. There's, I think, I know you have scout groups. So you have wrestling going on in there. You have the athletic teams use it from the school system. It just amazes me how many people use that facility.
Yep, we try to open up rentals right at 6:15, so we have time to get the center cleaned a little bit before they come in, and then, like you said, we have Boy Scout, Girl Scout, all the the travel teams that use the gym, like the basketball programs, AAU programs. We have a Millis aircraft group that comes in and uses the gym on weekends.
They're flying planes in there?
They fly planes, yep. And then we have, like I said, the Zumba, and then we have birthday parties. A lot of people don't realize that they can rent out the gym, and they can have birthday parties, and we rent out our Jumpy as well. So, on those key months, like I said, the center is Sunday to Saturday being utilized, and that's why we're so excited that with this renovation, we can even open up for even more opportunities, especially in the mornings, and where it's a safe and accessible. We can have younger groups and older groups in.
Right.
So.
Now, although I don't want to spend a lot of time talking about the renovation, again, we'll get a member of the Youth Commission in to officially talk about it. Nonetheless, is there a timetable for that?
For the renovation?
Yes.
Yeah, we just had a meeting actually last night with the architects. We're looking to go to bid in September. We're right on target.
Right.
And then starting as soon as that process is over. So, and hopefully 9 to 12 months is the time frame when they expect.
And where will everybody go while the building's being renovated?
That is the big question. We have a lot of people we're in contact with. We haven't secured a spot yet. So if anyone's listening out there and they have an idea or a location, we're going to find a place, but it's hard to get a confirmation when people are getting back to us, and so we'll
Unfortunately,
we'll
they probably know what day to what day.
Exactly.
And
yeah.
you can't do that till the bids are out. But what's a typical day life for you at the center?
It's crazy, unexpected. There's always something you don't plan for. We always have donations, which is good too. So today I came in and we went to Hopedale and picked up a table that a guy had made. He had worked over 10 years for his grandchildren to have his kids play with these remote control cars, and he didn't want to get rid of it, but he wanted to go to a good place. Heard about the youth center, and we went to his house, picked it up, and we have it for the summer camp program now. So a lot of times in the mornings, outside of our administration work, we have phone calls like that from the community where either we're going to a meeting or picking up a donation, or getting our programs out through outreaches and stuff like that. And then it's, we get to play with the kids, get to organize different programs, and then always plan
What's
for
the average
future.
age of the kids that come in the after-school program?
Well, it's open. The after-school program is open for 8 to 18-year-olds.
Okay.
We
Is it more?
predominantly have
Is it
middle
more?
school.
Yeah, I was going to say, is it
Yeah.
more middle school than elementary and high?
Yeah, we predominantly middle school kids, and then the summer camp is 8 to 14, specifically.
And you usually fill that up by the time it opens.
We do. We are still accepting applications, and we accept applications throughout the entire summer because our program is, you can pay by week or by day. So I think that convenience for people, as long as we have the registration by the Monday, the week prior to the Monday that they would like to start, and if we have availability, we'll take you in. So yeah, we're still accepting definitely, but we have a good portion of applicants already.
Okay. Now you've written. I'm trying to remember, about a year ago, you wrote a piece that I read. I think it was on Patch, that talked about how you get the best job in the world because you work at a castle.
Oh yeah. Yeah, that was, I had to do a speech when I came here as an AmeriCorps member, and I remember sitting down writing the speech and just wanted to explain to someone who never saw this building,
Right.
the type of building and the type of program and that I work for, and all I could think of was that, and it was during a rough time at the youth center, that the castle-like building, really symbolized what that building was for the kids. It was a sanctuary for these kids, and it felt safe for them. And so I felt really lucky in that sense that I got to work in such a beautiful historical building, but then it really lived up to everything that it symbolized to me. So,
well, I think for so many people who don't have after-school care, or the parents can't afford it, or who live in a town without a youth center, I don't think they can conceptualize of the things you do. I mean, I remember in past years you've had nutrition programs for kids. The JAG fashion show that you do every year. I'm just trying to think, the regional Cub Scout Pinewood Derby was there for like 5 years straight. I mean, I could go on and on. I've seen wrestling being taught there to youth groups at night, that it just amazes me. It's not like going to Planet Fitness or a gym where there's like 5 machines that you want to work on every day. It seems like, wait 10 minutes and you have a different program starting in the same facility.
It's true. I mean, and it's always why it kind of amazed me that it wasn't that way to everybody in the community, but thinking that in some aspect you had to be a part of one of those programs that had been utilized. But I think in this year and a half, I think we got the word out more than ever about everybody and everything that goes on in that building. So
I think it's also one of those things that flies under the radar. If you don't have a kid in it, if you don't understand what goes in it, it's that building for those kids, that you don't pay attention to it because life is so complex and busy these days, that I think the average person drives by it. I mean, I look at that building and, well, I went up on the roof to shoot some of actually the opening footage for the show. And I was just amazed at the view you get of the downtown area from being at the youth center. But it is a very central building in the town when you look at where it's located.
it is. It's perfect. It's right. I mean, for our purposes, for why the most important aspect of the building for us is the after-school program. It's right there downtown where the schools are. And it's so that the kids that need to walk there, they have access to it. And
I mean, it's what, 2 blocks from Stacy?
Yep. Right across from Middle East and not far from any of the other surrounding schools. So.
Yeah, and depending on what happens to the Middle East building, you might have a tie-in to whatever goes there. Although I don't think anyone has a clue yet what that's going to be 2 years from now or 3 years from now.
Not yet, nope.
But what are some of the challenges working in that building?
I guess there's 2 major challenges, I think. I mean, we're always understaffed, but I think it's kind of stressing, not necessarily stressing, but you're always kind of fighting against a perception where, we're not, I guess, we don't have a budget. So, everything we do, we have to do by fundraising.
Well, you do have a budget, but you have to raise most of that money in the budget.
I mean, we have, the town pays our utilities and the director's salary, and we have a revolving account, but everything that goes into that account is through fundraising, grants, and the TDA, things like that. So, everything from staffing to running a program to doing anything, we have to budget ourselves to make sense for what we're doing, and we have a spending limit also. So, a lot of people, I think, from the outside think, or question why we don't do certain things, but, we're always having to keep in line with that, and that's one thing. But then also the perception, I don't know how many times I heard about the type of kids that come there, and and it was always a little discouraging because we have great kids and I don't look at them in one way or the other way. So I think that's the biggest challenge, is just, you know, kind of always fighting the perception of what happens.
Well, my answer to that is those kids are the town's future.
Mm-hmm.
So, you know, they're either everyone's kids,
Yep.
you know, not just those kids.
Yeah, exactly. I mean, that's not how I look at it either, but it's just, you can't deny it. I mean, every time we have some discussion on the center or the importance, that comes up. So, I mean, we have every single type of kid that comes in there, and they're great kids, and we don't have issues. So, I think the town realized that with that vote. So,
I think it was personally sitting through the hour plus long architect's presentation to the finance committee, which thankfully was shorter at the town meeting the following week. You guys, all the people behind the renovation, did a tremendous job of outlining the reasons for it.
Mm-hmm.
And I was just telling somebody right before you came in here in the studios that of that 5.2 million, there's not that much of it is actually going to quote unquote renovate the building in terms of your programs.
Mm-hmm.
I think that's the gym floor.
Mm-hmm.
That most of the millions are going to structural and building code improvements.
exactly.
And that's kind of shocking when you realize that you're getting, you know, a brand new, from the inside out, safe building.
Mm-hmm.
But of that 5.2 million, it's not like 4 million is going for program enhancements.
Exactly. I mean, and that was also the hard sell of it too. You know, people were like, "What's all this money going towards?" You know, and it's like, we need this building to be safe and accessible, and that's what it's predominantly going towards. But the main floor, where the heart of the center, that's where a lot of the funds, like you said, the gym floor and the layout, so that it's more suitable for a youth center. But I mean, that's another, I mean, daily operations of the center. We've already got locked in different groups and different people that want to, you know, adopt a room, you know, for the future. So I really honestly see this building being almost completely, you know, program-wise from room to room within the first year of it being renovated, to see those rooms finished off, you know. We already have, like I said, businesses that have said they want to do something, and individuals. So.
Well, you know, I've talked to you in Sydney about Sydney's pet project, the boxing ring.
Yes, we're very excited.
And that I'm committed, once the renovations start, to help you guys raise the money to make that a reality.
Yeah.
I you know, I was in a boxing program myself as a teenager, and it has tremendous value, and you know, I'll help you go out and raise that money.
I know. We're very excited and thankful for that.
We're excited for that. Any closing thoughts about what it's like working at the city? You've been there, what, 3 years now?
3 or 4 years, yep, right out of
Time flies.
college. Yeah, I know. I can't believe it.
Good job?
It's a great job. I mean, there's obviously headaches with every job, but I cannot complain. I love what I do. I love the kids that I work with, and it's a special place, and I think the community has embraced it, and I'm thankful for that, and everyone that's helped along the process to make sure that this happens. So I appreciate it all.
That sounds great. So any last thoughts on the summer program?
Come sign up. It's the application schedule is online at our website at milfordyouthcenter.net, and you can call us for more information, but we're still accepting. So. Okay,
and you plan to reopen for the after-school program in the fall?
Yep.
For as long as you can until renovations begin?
Mm-hmm, yep. The after-school program almost definitely will not start at the youth center. I mean, the renovation process should start right away, but we'll have our doors open at some new location for that school year. So. Okay, so can we get you back and with Sydney towards the fall to get an update? Yes, obviously. We'll love to come. Okay, thanks for being on the show. Thank you, Kevin, as always. Okay.